Hi, everyone, and welcome to today's webinar entitled Hepatitis B Educational Resources for African Communities, which is jointly hosted by Hep B United and the Coalition Against Hepatitis for People of African Origin, or CHIPO. My name is Beatrice Zovich, and I am the Public Health Program Coordinator at the Hepatitis B Foundation and the Administrator for CHIPO. As part of Hepatitis Awareness Month, our panelists today are going to share about the creation and utilization of multilingual and culturally appropriate educational resources created as part of the CDC's Know Hepatitis B campaign that are designed specifically for health educators and members of African communities in the United States. We will also hear about the personal experiences of living with hepatitis B and participating in community outreach from one of the storytellers from our Just B storytelling campaign. Next slide, please. So just a quick overview of how to participate in GoToWebinar. Before we get started, I would just like to remind all participants that during today's webinar, you will be in listen-only mode. If you encounter technical difficulties online with computer audio, please dial in using the phone option on your control panel with the conference line shown here. At any time during the presentation, you can enter questions into the question box. Questions will be addressed by the speakers at the conclusion of the presentation. If you have any technical challenges, please indicate your issue using the question box as well. Next slide, please. So just to give a quick overview of Hep B United. So Hep B United is a national coalition that is dedicated to reducing the health disparities that are associated with hepatitis B by increasing awareness, screening, vaccination, and linkage to care for high-risk communities across the United States. It is comprised of 49 local coalitions and national organizations in 29 cities and 22 states, as well as the District of Columbia. Next slide, please. Okay, and now for just a quick overview of CHIPO. So CHIPO is, again, the Coalition Against Hepatitis for People of African Origin, and it is also a national community coalition that was co-founded and is led by the Hepatitis B Foundation and is comprised of organizations and individuals interested in addressing the high rates of hepatitis B infection among African communities in the US. CHIPO serves as a forum for sharing information and best practices, and similarly improving national capacity to improve hepatitis B awareness, testing, vaccination, and treatment among highly affected African communities. We currently have 35 coalition members from around the country. HBU and CHIPO are both very excited to be jointly hosting this webinar today. Next slide, please. Okay. And now to introduce our speakers. So we're very excited to have 3 speakers join us today. We will have Carrie Sapsis, who is the lead of the communication team at the Division of Viral Hepatitis at CDC, Dana Yamane, who is the HBV project coordinator at African Services Committee in New York City, and Bright Ansah, who is one of our Just B storytellers and a hepatitis B activist. We're very thrilled to have these 3 distinguished speakers join us today. And without further ado, I will hand it off to Carrie to start us off and provide us with an overview of the creation of these materials.
Thank you so much. First, I would like to give a shout out to all of you out there in the community and on the front lines at the state and local level doing great work during such difficult times. Thank you for joining us. Hepatitis Awareness Month is as much about awareness of hepatitis as it is about celebrating the great work that all of you do. I'm very honored to be here today and really grateful to CHIPO and Hepatitis B Foundation for sponsoring this webinar and for inviting me to join. So let's go ahead and get started. Next slide, please. So hepatitis B is one of the most common infections around the world. African immigrants account for approximately 12% of Americans living with chronic hepatitis B, and people in these communities face barriers to hepatitis B screening, vaccination, and linkage to care. Starting in 2016, we collaborated with Hepatitis B Foundation to help respond to these needs. Next slide, please. So we worked with community leaders, public health experts nationwide, and with individuals in the communities to assess individual, interpersonal, community, and society level barriers and facilitators associated with hepatitis B screening, vaccination, and linkage to care. The goal was to better understand these barriers and facilitators and to enable CDC and its community-based partners to create materials and resources to improve knowledge and awareness, reduce stigma, and increase hepatitis B screening, vaccination, and linkage to care. During phase 1, together with Hepatitis B Foundation, we gathered data through a literature review and several qualitative studies. We wanted to ensure that any messages and materials were informed by the lived experience of the target audience and that these would address their concerns and any information gaps. We learned from them about their level of HBV awareness, about their healthcare barriers, cultural beliefs and traditional medicine use, religious beliefs, perception of stigma, and lack of resources, as well as fear and mistrust of the government and of the healthcare system. Once we had done the formative research, we then created draft materials, and in phase 2, we pilot tested and finalized those materials. Next slide, please. A number of products were created to help community health workers, healthcare providers, and members of the community. Here on the right side, you see an image of some of those materials. There is a training for community health workers in a PowerPoint format, which includes information about hepatitis B basics and tips for educating others. There is also a flip chart, which can be used with members of the community during a clinic visit or an educational session. It's a bi-facing product, and so that means on one side there are talking points for the educator, and on the other side there's images and content to help the community member who is being educated. Last, we created fact sheets that can be distributed at health fairs or by clinicians. They are available for download from the CDC website. We also make hard copies available from CDC Info for order. Currently, the fact sheets on the CDC website are available in English, Amharic, Arabic, French, and Swahili. Additionally, there are some unique fact sheets that are available specifically on the Hepatitis B Foundation website. For example, the one that you see here on the top right called Key Facts. Next slide. I wanted to ensure that for those of you who are not yet using the materials, that you knew where to find them. You can get to them from either of these websites because this was a collaborative project, except the materials that are available for order are only available on the CDC website. So the first site there is our Know Hepatitis B campaign site with all of the materials, and on the Hepatitis B Foundation site, you can find the flip chart and the PowerPoint presentation. Next slide. So in closing, I just want to say thank you to our partners in the community. Thank you to all of the people who were willing to work with Hepatitis B Foundation and be on the community advisory board. It took a whole community effort to put these materials together, to get them produced, and I greatly appreciate everyone's efforts. And I hope that all of you today will learn more about how you might use them and share among yourselves what has been most successful, most helpful to all of you. Thanks.
Great. Well, thank you so much, Carrie, for that really great summary of how the resources were developed. It's great to know that background. And I would now like to invite our next speaker, Danait Yamane, who is joining us from African Services Committee in New York City, to share her experiences of using these and other materials with members of African communities. So Danait?
Hi, everyone. Can you hear me?
Yes, we can.
Okay, awesome. I apologize. I'm not going to be able to show my video just because of some technical difficulties, but as long as you can hear me, I think that's the most important part for the presentation. But thank you for the warm welcome. My name is Danait Yamane. I'm the Hepatitis B Project Coordinator at African Services Committee, based here in New York City, as Beatrice said. Next slide, please. So I'm just going to start by giving a brief overview of what I'll be talking about today. First, I'm going to give a brief introduction to our organization, our Hepatitis B program, and then I'll discuss how the program has changed during the COVID-19 pandemic, and our use of the Know Hepatitis B resources and feedback from our staff. And then I'll just conclude with what our plans for the future are as the pandemic cases start to decrease. And, we'd love to open it up also at the end for any questions. Next slide, please. So to start with a little context about us, African Services Committee is a multi-service agency based in Harlem, and it's dedicated to assisting immigrants, refugees, and asylees from across the African diaspora. We provide health, housing, legal, educational, and social services to roughly 10,000 people each year. And of these services, one that is especially important to our community is the work that we do with combating viral hepatitis. Since viral hepatitis is endemic to 8 to 20% of the African continent, our hepatitis B program aims to increase access to free education, testing, treatment, and linkage to care for viral hepatitis to reduce liver cancer deaths among African immigrant populations. Next slide, please. So before the pandemic, ASC provided viral hepatitis testing, treatment, linkage to care, and educational counseling at our office here in Harlem. And we hosted viral hepatitis B community awareness and screening events throughout New York City. These events allow participants to receive hepatitis B and C education and screenings for free. We provided educational resources like the Know Hep B resources and materials to participants, and we talked to them about the importance of getting tested and knowing their status. But once the pandemic began, we really had to close our office like most people and start working from home. So we did that between March and June 2020, and then reopened on July 6, 2020. And with COVID-19 precautions in place, resumed our viral hepatitis testing and screening and linkage to care. So once we did reopen, our rates definitely declined in terms of the number of clients who were coming in to get screened and tested for viral hepatitis. But between July 6th and May 2021, we tested a total of 134 clients, so roughly 13 clients per month. And all of our positive clients were linked to care. Our susceptible clients were offered the 2-dose Heplisav hepatitis B vaccine or opted to use their own provider for vaccination. And all of our immune clients were notified of their results as well. And clients who had unclear results, like people who were isolated, core antibody positive, were provided counseling on hepatitis B reactivation. So we did still manage to reach people in the community, and we also hosted a couple community outreach testing events as well at places of worship, so like churches and mosques, where we had about 13 clients who were tested, and we also hosted some educational workshops remotely in English and in French on viral hepatitis as well. So this was, again, to try to accommodate a lot of the changes that have happened during the pandemic, since most things now are remote, like this webinar. And we had about 30 participants in total who attended these online workshops, and we're planning to continue having them to continue to promote, our viral hepatitis education and counseling. Next slide, please. So ASC staff have used the CDC's Know Hepatitis B resources in our educational counseling sessions with clients. So during our monthly webinars that I mentioned previously, which are on understanding the basics of hepatitis B, we use the resources to answer a lot of common misconceptions and concerns that clients have regarding hepatitis B. We've also used the resources to better explain concepts related to hepatitis B to our clients, and the staff in general have found them to be extremely helpful. They're very clear, they're very easy to use, and we also really appreciate how the images and graphics are geared toward African populations, since they mirror the communities that we work with, and they make the content very relatable for our clients. Another thing that we've also really appreciated is getting to hear more about the real life experiences of folks highlighted in these resources. So like Bright, who I know is going to be participating in this webinar today, his video and his experience with hepatitis B has been extremely helpful for us to show to our clients. And we show the video during our monthly webinar workshops as well, to kind of engage people by having, a narrative of a relatable story of someone who has hepatitis B and how they've managed to live and still have a very productive life with it. So the only piece of feedback that our team has had is that because we have so many French speakers, we would also love to have a video of like an African immigrant or someone else, describing their experience with hepatitis B in French or another common African language like Wolof or Bambara or Mandingo, since those languages are commonly spoken by the clients who come to our office. Next slide, please. So in the future, we plan to increase our community outreach programs and testing events to encourage clients to come to the office. And we do plan to resume, hopefully the same rates that we once had for testing throughout the city and all 5 boroughs of New York. But this also, again, will only be, if the cases start to decrease and continue to stabilize in New York. So still pending what the future holds. But during these offsite testing events and in our office, we plan to distribute the CDC's Know Hepatitis B resources to our clients, and we'll continue to present these resources during our educational workshops, which we do host now once every month on viral hepatitis. Next slide, please. So yeah, that's everything. Thank you so much for listening. And I guess at the end, we'll probably discuss any questions or comments, but thank you.
Great. Thank you so much tonight. We really appreciate learning about your insights and your experiences with these materials. And we're glad to know that they've been helpful in raising awareness about hepatitis B in affected communities. So now we are very excited to hear the perspectives of someone who has been personally impacted by hepatitis B. And we're really fortunate today to be joined by Bright, who has been very active in hepatitis B work through raising awareness, advocacy, participating in the Hep B Foundation's Just B storytelling campaign, and working with the Hepatitis B Initiative of Washington, D.C. to manage screening and vaccination efforts among African communities in the D.C., Virginia, and Maryland areas. So we will begin by viewing Bright's Just B Storyteller video, and then we'll be speaking with Bright himself about his experiences, both living with hepatitis B and encouraging screening, vaccination, and linkage to care through awareness and education. So we can go ahead and watch the video.
I was born in a small town in Ghana. My family was not wealthy or powerful, but my mom cared for me and my 4 brothers. We loved her special pancakes made with nutmeg and fried in coconut oil. Somehow, I managed to finish teacher training college, won the American visa lottery, and emigrated to the US. I was shy and quiet, but I thought of myself as pretty strong and resilient. Life had not been easy. 5 years later, I learned that my mom had passed away back home. All of my earlier strength and resilience fell away. I couldn't concentrate. I wanted to hide from the world, and sometimes I didn't want to live anymore. My friends helped me so much. They said, "You loved your mom. She would not be happy seeing you give up on your life." So I got some counseling and I got a little stronger again. But then I started feeling tired all the time. 4 or 5 days a week, I had absolutely no energy. My doctor helped me, and eventually I learned that I was living with chronic hepatitis B. I started treatment, but the fatigue and back pain got worse. Were they connected? Every morning, I woke worrying about my future and what will happen next with my hepatitis. I might be okay today, but what about tomorrow? Or next year? Or 5 years from now? Slowly, I started to have days when I wasn't hopeless, when I could face the unknown. I talked to my doctors, did my own research, and made my own decisions. A year later, my brother came from Ghana and I picked him up from the bus station. After a moment, he said, "You have changed." I couldn't imagine what he saw so quickly in me. But now I realize I have changed. I am more resilient than ever before. Just be resilient.
Great. Well, such a beautiful video and powerful story. Thank you so much, Bright, for sharing your story with us. And I will now invite you back on. Great. And we'll do kind of a brief Q&A just to talk a little bit more. So first, I was wondering if you could tell me a little bit about your experiences working with doing kind of awareness and education work in African communities in the DC area and promoting testing and vaccination for hepatitis B.
Yeah, thank you for having me, and I'm glad and happy to be here. So I started working with HBI DC a little bit about 2 or 3 years ago, and that was after I actually did my video recording in California. So I think I got to know them through Hepatitis B Foundation, and I kind of just reached out because I was interested in doing something within the community, not just doing the video, but my whole purpose of doing the video is actually to help save another child from becoming a statistics, just like I became a statistics. I wanted to stop that from happening. So my whole hope and goal was to do the video, get involved, so I can stop someone else from becoming me in a way. So it's really been interesting because we've done so many outreach in the community here in Maryland, Virginia, and DC, and it's been good. Before the pandemic actually hit, it seems to have slowed down a bit, just like everything else that have slowed down. Our outreach events have also slowed down, but it's really been good. I get the opportunity to talk to people. I get the opportunity to share my video and share my story as well, and educate them and do a lot of awareness about hepatitis B. So it's been pretty great.
That's wonderful. Yeah, that's so great that you're able to kind of translate your experiences into activism. And I'm sure people, after speaking to you, they may be able to build a level of trust and maybe be more willing to engage in screening and vaccination efforts. Do you find that?
Yeah. So actually, there've been so when we first started, it was a little bit. The numbers were not great when we first started. Sometimes we go to events, it wasn't really, really, we were not getting people. And I don't know if it was because we were not convincing them enough, or something was going on. But what started happening was we started reaching out to churches in the community. And so we started partnering with those churches, and they will invite us to church events on even Sundays. After preaching, they would give us the mic. I would do a lot of education, and then through that we would do screening. And we started seeing that because people trusted the pastor who has invited us, people listen when we talk about hepatitis B. And so we started seeing our numbers kind of increase. So like you did mention about trust. So trust is very important in this kind of work that we do. And without trust, it's really difficult to convince people that they need to take action or do something about this virus.
Yeah, absolutely. So that's so great that you were able to do that outreach. I know you were speaking a little bit about your diagnosis in your video. Did your doctors know or believe that how much testing did you have to go through to get your hepatitis B diagnosis? Did they find it quickly, or did it take kind of a long time to identify it after you started experiencing symptoms?
Yeah, so I think it went a little bit because when I started having the chronic fatigue and reported it to my doctor, we didn't start looking at it from a viral perspective, but we, just as usual, we went through other elimination process, and most of my lab results were, or tests that were done, were coming back, but most of them were negative. We were not finding anything. And at some point, the doctor thought maybe it could be depression.
Mhm.
But I told her that I don't think it is depression because it's not something that is happening. I don't get depressed. I have issue with depression, but it's not something that is very severe to happen, like maybe knock me down for a month or so. It's not something that's happening that way. It's something that happens once in a while, and so it was in a severe form. And so from that point, it was like there wasn't anything else to do. So she finally thought of something and said, uh, will you be willing to get STI test? And I said, sure, I need answers, so why not? So it was through that actually that we found hepatitis B. After the test, that's when we found out that I was positive for hepatitis B.
Okay, so it was sort of a process of elimination process. That makes sense. And I know you had talked about doing some research on your own. Was that did you find you weren't getting all the information you needed from your doctors and others, or what kind of prompted you to do more research on your own?
Yeah. So when I got the diagnosis, so before my diagnosis, I've heard about hepatitis B, but not a lot. And I never took the time to really do any reading or find out what it is. I just know it's a virus that is out there. That's my basic knowledge about hepatitis B. So when I find out that I found out about my diagnosis, that's when I started having questions. And so I started asking, how did I get it? How did it happen? And all those questions, I wasn't getting any answers. So I decided to do a little education and find out what actually hepatitis B is, and how do people contract it, and stuff like that. So it was more for personal growth and understanding of the disease itself more than uh, trying to get answers from doctors about, or maybe not really getting the answers I need from doctors. And I was doing my own research. So it was more for me to really understand what is going on and how this happened and stuff like that.
Yeah, absolutely. That's great to learn as much as possible about it. Do you think the resources that we're sharing today are helpful for community members?
Yeah, definitely. I mean, it's very important to have this kind of information, especially in local dialects or local languages that most people speak. So I'll give you an example. We had an event in a community down in Silver Spring, Maryland, and it was a large French community. So most of the people living in the community were French-speaking people, some from Sierra Leone, Senegal, and Cameroon. So at the event, going into the event, I didn't know that I expected that probably majority of the people present will be speaking English. So my education was in English, but then I find out a lot of people actually didn't really understand English. They did understand French, and I don't speak French. And nobody on the staff spoke French either. So that was a big issue because immediately we realized there was a language barrier. So anything I was saying in English, just a few people were really getting what we were talking about or what we were saying. So fortunately for us, there was a lady who was good in translating. She speaks French and she also speaks good English, so she was able to translate, and that was our saving grace. And we didn't have any material; everything we have was in English. So having the opportunity to have a material in another language, I think is very beneficial in situations like that. In case there is nobody who can translate, then you can at least base everything on the materials and use those materials to help do the education.
Yeah, absolutely. Yeah, that's a great story, and yeah, it's good. These materials are in French, Amharic, Arabic, and Swahili. So, so yeah, it's great to have them be multilingual. So, just two more questions. So, what do you think are some of the biggest barriers to getting tested for hepatitis B in African communities?
Yeah, so the first issue is, like I mentioned earlier on, is with trust. So sometimes people have issue with trust, and you can't blame them for not believing in the healthcare system because of past histories with the U.S. healthcare system and minority people. So you can't blame them for that. So being able to build trust actually goes a long way. And as we find out from the beginning, it was a little difficult, but as time went on, we were able to kind of build trust. We were able to reach out to people in the community that people really look forward to and they could trust. And so those were the people that we kind of reach out to, and they introduce us to the community. And so we find out to be very interesting. And then another issue is with the language barrier. It's like sometimes you go into a community, you expect everybody to speak English, but then that doesn't happen. You realize that's not the case. And so you have that issue becoming a barrier as well. And I just think generally it's just a lack of resources in the community is also another issue. Because you look at the fight for hepatitis B, most agencies or most agencies established to help Asian Americans seems to be doing pretty well. They are at the forefront. They are really organized. But then you look at agencies that work to help African communities, it seems like there is zero to none. And even if they are there, they don't have that much resources to be able to spread out and go deep into the community. So I find that to be an issue. So it's also a barrier if you don't have the resources to, let's say you can only do testing and you can't help link people to care if they need treatment, then what is the essence of testing the person, you know? And so that's another issue. And then insurance is a big issue as well in the African community because most people don't have insurance, so they don't even get to see their doctors, and it's a big issue. So
Yeah, absolutely. So it sounds like really trying to meet people where they are and having sort of replicating models to help African communities that are highly impacted. Okay, and then so last question. Is there anything that you think beyond community outreach and engagement would be helpful to help increase Hep B awareness, testing, and vaccination in African communities in the US?
definitely. So I think uh, tackling the issue of stigma and discrimination is a big one. Stigma is still a problem in among African communities, and most of this stigma just didn't pop up from anywhere, but is probably due to lack of education and understanding of hepatitis B and what it does. So some of the issues with stigma is you have myth and a lot of uh, what is it, like myth and a lot of distortions in African communities. So someone get diagnosed with hepatitis B, there's this belief or idea that this person probably is promiscuous, that's why they got hepatitis B. Or they got hepatitis B because of something bad they've done, and as a way of punishment, that's why they contracted hepatitis B. or some people also think it's just evil. It's just evil people who, like hepatitis B, is being driven or being spread through evil means or evil spirits. But if you understand what hepatitis B is, you know hepatitis B is blood-borne, and so it's people contract this virus through coming into contact with infected blood or body fluids with blood in it. So if you understand this, then you can deal with a stigma. But if you don't understand the disease, then people continue to propagate this stigma, which goes a long way. And so it affects even just trying to convince people to get tested. It becomes a big issue. I mean, and I have a perfect example. I tried to talk to my siblings after my diagnosis, and my younger brother, actually the one that follows me directly, I tried talking to him about getting tested. He didn't want to get tested, and I asked him why. He said, well, I don't want to know because I don't want anybody looking at me in some way. And I was like, what do you mean by that? And he said, well, people are getting isolated, people are getting treated badly just because of this. And I'm like, really? But he didn't want to do the test, but I had to convince him. And fortunately or unfortunately, the good thing is he was diagnosed with hepatitis B himself too. So it's in the family. So I was trying to get everyone to get tested, but they were scared of getting tested because of the stigma that is in the society. So it's a big thing. So tackling that and also discrimination, I think, will be something in addition to the education and raising awareness and doing all the good stuff. I think that would be big if we can do more about that.
Yeah, absolutely. Yeah, I think that those are big concerns in many communities for sure. And I know these resources try to address some of the misconceptions that occur for sure. And in terms of discrimination, we're actually starting to do some more work around discrimination, which will be launching shortly. So stay tuned for updates on that. So thank you so much, Bright, for sharing your story and for all of your work. It's really, really inspiring. I so appreciate your time today. And now I will go ahead and invite all of our speakers back, if everyone wants to put their microphones and cameras back on, to take some questions from the audience. And a reminder for all audience members to please place your questions in the question box, and I will pose them to our speakers. So let's see, just give me 1 second. I think we had one from the beginning. So this is actually a question for Carrie. So thank you so much for the CDC's Hepatitis Awareness Month materials. I'm wondering if there will be a Twitter chat for Hepatitis Awareness Month as there was last year from the CDC.
Thank you so much for asking. I appreciate it. Unfortunately, this year we have all brand new staff and only myself and one other person. And so we just decided that we did not have the capacity to sponsor and support our own Twitter chat, but we did create materials that are available to all of you for free with sample tweets and posts and also images, which you are welcome to access on our website, cdc.gov/hepatitis/awareness.
Perfect. Well, thank you so much for sharing that. So the second question, which I think is kind of a broad question for any panelist, is what is the end use or goal of screening and testing participants? Does it only end in the level of helping them know their statuses, or what else can we do with the results obtained in order to help our government? So I think perhaps to inform policy or help individuals or help in the larger systemic problem. If anyone wants to take that.
I can take that. I started
Sure.
to answer it in the chat box. So I think our end goal is to reduce the risk of liver cancer among our communities, among African and Asian, specifically communities where the rates of our hepatitis are a lot higher. And so the ways that we can reduce those rates again of liver cancer, and the disparities are by getting people to know their status. Like once someone knows if they're hepatitis B positive or negative, or, if they've been exposed in the past, then they can make, the relevant choices after that, whether it is to get the vaccine if they're negative, if they're positive, to follow up with their primary care provider and follow, relevant treatment plan. Or again, like the lifestyle choices that are also associated with trying to have, a healthier liver, like consuming less alcohol, exercising, like all of these things are decisions that people can make after they know what their status is. And so we want to help with that first step, which is just to encourage people to get tested, and to start having those conversations, and to encourage people in their communities, so in their households specifically, and then, their broader communities as well. So the more people that are tested and who know their status, then the hope is that, those rates of liver cancer will definitely decrease, because we'll get people relevant treatment sooner. And we hope that with seeing those numbers that, we can also encourage our local health departments and governments to allocate more funding for research and testing and screening programs like ours, so that we can continue to provide these relevant services.
Yeah, absolutely. These kinds of community programs are so important, and it's so important to note that hepatitis B is manageable, and that you can be monitored, by a doctor, and that's why it's so important to, as you said, know your status.
And for the second part of that question too, just about cost, because so many of the, the communities with which this specifically targets are either lower income, or, potentially have language barriers if they're immigrants and not, born in the United States. We already know that access to treatment and education is limited. So we want to eliminate as many barriers, again, to treatment as possible. And I think that keeping cost, like, money is always something that's going to stress people, but making sure that we can provide these services for free is really important, because we don't want to, give any other potential barrier or incentive for someone to not want to get tested, especially because there's already stigma that's associated with hepatitis B. Like, we want to make it as easy as possible for people to feel comfortable and like they're not losing anything by getting tested and knowing their status.
Yeah, absolutely. Eliminating as many barriers as possible is key.
Yeah, just to add to that is, so as we know, many people who have hepatitis B don't show any symptoms until the disease is well progressed, and it's at the end before they start showing symptoms. And by that time, actually, there is nothing that can be done to help those people. So part of the idea is to reach them before they get to that end stage where there is no hope and there is no help. So the idea is to kind of help them now, find them now, before, let's say, nothing is done, and then 10 years down the road, they have liver cancer and they are facing, they are in a dire situation. So not just trying to test them and finding people who are positive, but also to find people who are negative and improve the vaccination uptake as well. So, and then we also try to reduce liver cancer cases, and also just try to link people to care, and just help them live a healthy life and be safe in a community.
Yeah, absolutely. Two really important points about often no symptoms, and that the vaccine is available and highly effective for those who might be at risk, for sure. Okay, so another question is, let's see. So for Bright, after carrying out outreaches in communities, how can we evaluate the impact and the effectiveness on the community outreach?
So usually what we do is, when we go into a community, we once we do education, sometimes we run polls, or sometimes we have a short survey that we give out to the people who we do the education, and we get feedbacks from them. And sometimes we also see the feedbacks to the number of people who sign up to get screened or register to get screened, because when we go into the community, we just don't do the education and leave, but we also have screening events at that program. So after the education, we open and then people sign up to get screened. So most of the time, we can also see that through the number of people that are signing up as to how effective our education program is. And we also get feedback from the surveys, or you get people who come to you and they will say, oh, thank you for coming in, and I think it was very helpful. This is what I learned, and this is what is happening in my family, and how can we go? So you get all this feedback in one way or another way, another form. And so that's how we kind of assess. And sometimes we sit down and we ourselves also assess what do we think happened in that situation.
That's great. That's great to be able to receive that feedback for sure. So this is for any panelist. How do you advise approaching African communities who are wary of vaccinations?
I think this one, yeah, this is definitely challenging. I'm definitely seeing this as a barrier even currently in our offices, since we're starting to get the COVID vaccine and we're trying to encourage community members, as we do for hepatitis, to get vaccinated. I think it just, requires a little bit of patience, trying to also, empathize, especially because there is historical context, even especially as being a person of color in the United States and being weary of vaccines, right? There are several research studies where, people have been mistreated and abused for the sake of science. And I totally empathize with people who are very scared of getting vaccines. I really think, though, that we just have to continue to kind of push the results that are backed by the science and show the efficacy that is associated with vaccines and how people, can stay healthy longer if they do choose to get vaccinated. But it is something that I think we have to kind of, be delicate about discussing, just because there's just so much historical context as to why people are validly, nervous about wanting to take any kind of risk like getting vaccinated.
Yeah, absolutely. For sure. So let's see. So there are some questions that are related to funding opportunities for NGOs in Africa to do hepatitis B advocacy work. I'm not sure if anyone here has any thoughts on that or would be able to answer. That might be outside the scope, but does anyone have any thoughts on that?
Well, I mean, it's been something I've been thinking about, and I look forward to the outreach just not being here in the States, but probably reaching out even further beyond the boundaries of the US, because most of the time we go to the community, a lot of people who are here in the States, some of them take advantage of the resources here in the States, but their more concern is with their family members back home, especially me being a Ghanaian. You hear that a lot. They are worried about family members in Ghana who don't have that access. And so it's a very serious issue, because I was doing a little research the last time. It sounds like 60, it's estimated that there is about 60 million people in Africa with chronic hepatitis B. Out of that 60 million people, 21 million people need treatment. But so far, only 37,000 people have access to treatment. And to me, that is troubling. That's troubling. I mean, 37,000 out of 21 million. And we know on the continent that liver cancer is actually now #1 killer in Africa. And 55%, about 55% of all liver cases, liver cancer cases can directly be linked to hepatitis B infection. So to me, it sounds like a lot have to be done. So I will also use this opportunity to ask for anyone who knows policymakers or anyone to advocate on behalf or on spanning funding to cover some of these things and help some of build some form of coordination with African nations to try and step up their testing and vaccination and treatment. And so it's a big issue. I mean, there are people who are screened, they need treatment, but they don't have access to the medication or they can't afford the medication. And so I think being able to reach out beyond the Western world will be really helpful in most African communities.
Yeah, absolutely. I think trying to build up infrastructure and certainly put in just much needed resources there is really critical. So yeah. So that is all the questions from the audience, which is perfect timing. So thank you so much again to all of our speakers today for your time and your insights. We really, really appreciate it. And thank you for everyone who participated today and for all of your questions and engagement. And we hope that you found this informative and valuable and that you can apply some of it in your work moving forward. So before we end today, we just wanted to make sure that everyone knows a few resources and upcoming events. So just one more time, this is where you can find the link on the screen is where you can find the resources that were shared today, which will also be shared in the chat box, as well as in a follow-up email to all attendees. And we also wanted to just briefly speak about some ongoing campaigns that the Hepatitis B Foundation has going on. So one of them is an ongoing campaign called More Than B, which is where we will be collecting stories and photos from people who are connected to hepatitis B in some way to be featured on social media first throughout the month of May. So it's already begun in celebration of Hepatitis Awareness Month, and then also we'll continue to collect them on a rolling basis throughout June and July to culminate in World Hepatitis Day at the end of July. And the purpose of the campaign is to highlight the stories of people who are living with and connected to hepatitis B in some way, but to focus on aspects of people's lives, such as their hobbies or family or achievements that bring them joy and that make them just more than just hepatitis B or more than B. So we will be featuring these stories from people living mainly in the United States throughout the month of May, and then we'll continue to feature stories from around the world leading up to World Hepatitis Day at the end of July. So we'd love to have you participate if you would like. And the link to the survey where you can submit 1 to 2 photos and a short paragraph about what makes you more than B will be shared in the chat box. And it will also be shared in a follow-up email as well. Please feel free to submit your story and to share with your networks as well. And then just 2 other resources and events that we have to be aware of include first, the Hepatitis B Foundation's brand new podcast, which is called Be Happy, and which features interviews with important guests on topics that are relevant to hepatitis B and public health. And it's hosted by our public health and outreach coordinator, Evangeline Wong. And it is available to subscribe on Apple Podcasts, Spotify, and Amazon. So be sure to check that out. And finally, in addition to being Hepatitis Awareness Month, May is also a celebration of Asian and Pacific Islander American Heritage Month. And so in honor of that, the Hep B Foundation and Hep Free Hawaii will be jointly hosting a discussion on Facebook Live about the All of Us research program, which is working to increase diversity in medical research participation and to eventually use this research to increase the practice of precision medicine, which is healthcare that is tailored to each individual person. So we hope you can join us on Thursday, May 27th at 3 p.m. Eastern Time on Hep B United's Facebook page. And the link to that is being put on the chat now and will also be included in the follow-up email. And next slide, or now for our last slide. So we thank you so much for joining us today, and we encourage you to complete the evaluation form for the webinar. And please do feel free to reach out and get in touch with us using the contact information on the slide and visiting our websites for more information. So thank you so much again to all of our speakers for joining us and for all of our audience members and for the great engagement, and have a wonderful afternoon.
Thank you.
Thank
Bye.
you. Bye, everyone.
Thank you. Bye.